Hello, my name is Bridget Sturmel, and I'm going to be presenting on the best practice recommendation for assessment and management of post-traumatic stress disorder in veterans. So, post-traumatic stress disorder is a condition of persistent mental and emotional stress occurring as a result of injury or severe psychological shock. This disorder can disrupt sleep, create vivid recall of traumatic experiences, and dull a person's responses to the environment and people around them. Military members are a large targeted group of society who often suffer from PTSD due to stressful things that they go through, such as basic training, advanced individual training, and deployment. Unfortunately, this causes roughly 22 veterans to commit suicide every day from a type of mental illness that relates to PTSD. Being able to recognize and diagnose someone with PTSD is the first step to knowing how to manage and treat this disorder. Someone with PTSD usually experiences symptoms longer than 1 month after that they are diagnosed with PTSD. Flashbacks, nightmares, and re-experiencing this event over in their head is also a symptom. Sometimes it may make you emotionally numb and cause you to avoid certain situations that might bring up these feelings and experiences that were traumatic to you. Difficulty sleeping, concentrating, and being easily irritated and angered may also occur due to always thinking about the traumatic event or having it on your mind. PTSD is a disorder in which the patient needs to discuss their symptoms. This isn't something that we can see or something that we can take an x-ray on or a CAT scan. So being vocal and having a discussion with your patient is important. Therefore, they created questionnaires such as the PRIM PTSD and PCL questionnaire, which have both been proved to be valid questionnaires to accurately diagnose PTSD. Right now, currently, the PCL checklist is the current and standard diagnostic tool for assessing someone with PTSD symptoms. This PCL checklist shows factors such as lower educational level, being married, being in the Army or Marine Corps, moderate to severe combat, and history of severe stressful situations are common among veterans with PTSD. The SAQ, also known as Social Acknowledgement Questionnaire, shows that family and general disapproval are associated with PTSD and depression among veterans. Now, everyone may experience different symptoms for PTSD. My brother just recently came home from an 11th month deployment and felt a disapproval amongst himself because he wasn't on the front lines of battle or as an infantryman, he was inside on a computer working on computers, which caused him to be depressed. Depression often goes hand in hand with PTSD and can come from the positive and negative social reactions to veterans' traumatic experiences. Coordinated and alternative pathway to engagement, also known as CAPE, should be used for treatment of PTSD. CAPE used cognitive behavioral therapy, which shown to reduce PTSD symptoms for long-term effects than other methods. It was a 6-month thing where veterans used this cognitive behavioral therapy. Not only did it found patients to be more likely to engage in psychotherapy, but also reduced symptoms of PTSD significantly. Another option for veterans could be treated through a telephone-based collaborative care system. Everyone doesn't have the same resources, so having an option to call and be able to discuss or go through a cognitive behavioral therapy session with a professional showed to be very helpful and reduced PTSD symptoms significantly as well. And these are my references, and thank you.